Your skin is a highly sensitive alarm system, and sometimes it trips without warning. A sudden flush of heat, an aggressive red flare-up, and you're instantly trapped in the physical discomfort of an allergic reaction. It rarely takes much to set it off. A casual walk through tall summer grass, or a single, barely noticeable bite from a passing ant is all it takes to trigger the histamine response. What follows is a persistent, undeniable itch. It anchors itself deep in your skin, stubbornly refusing to fade no matter how much you try to ignore it. Within minutes, what started as a mild annoyance scales up into a dominant physical distraction, pulling your complete focus away from whatever you were doing. And these reactions have a habit of striking at the absolute worst moments. You aren't usually sitting alone in a sterile room. You're out at a dinner party or in the middle of a crowded gathering. Suddenly, you're the person scratching at your arms or trying to manage a continuously runny nose while attempting to hold a normal conversation with your friends and loved ones. Factor in the rising heat of a humid summer day, and the physiological response only intensifies, making the symptoms difficult to hide or ignore. You are suddenly on a ticking clock. You need a way to chemically intercept that histaminic chain reaction before it completely derails your evening. Left unchecked, these symptoms become a persistent social distraction that requires a rapid medical response. In India, a standard medical intervention for this exact crisis is cetirizine, a prescribed cetirizine tablet manufactured by Dr. Reddy's Laboratories. At 32 rupees for 15 tablets, each dose costs roughly 2 rupees. A radial diagram shows its coverage, targeting intense itching, suppressing hives, and neutralizing redness from insect bites. Expanding to respiratory pathways, it halts sneezing, dries runny noses, and relieves ocular swelling from conjunctivitis. This specific formulation operates as a comprehensive shield, capable of shutting down a disparate array of bodily reactions all at once. While the range of symptoms treated is vast, the practical value for the user often comes down to the timing of the intervention. Once ingested, the active ingredients begin stabilizing the body's histamine levels, initiating a noticeable turnaround within a 20-minute window. Your body makes a transition from a state of relentless scratching and sneezing back toward a baseline of physical calm. All of this restorative effect is packed into a tiny, unassuming white tablet. The primary benefit here is the speed at which this small intervention restores a sense of normalcy to your day. This rapid relief comes with a distinct biological catch. Neutralizing histamine introduces a new physiological state, marked by mild to severe drowsiness. Because of this specific sedating effect, the primary behavioral guideline for the medication is timing. Doctors recommend taking the tablet at night, allowing sleepiness to coincide with your natural rest period. If you take it during the day, there are absolute prohibitions immediately following ingestion. You must not drive a vehicle or operate any heavy machinery. You are making a distinct trade with your biology, accepting a state of temporary drowsiness in exchange for absolute relief from your allergic symptoms. Despite its low cost and availability, cetirizine remains a potent, scheduled prescription drug that must be strictly handled according to professional medical guidance. There are firm demographic boundaries in place. Keep the tablets away from children, avoid use during pregnancy or while breastfeeding, without direct medical supervision. This creates a dual reality for the user. You have access to an affordable, rapid-acting antidote for daily physical misery. However, you are responsible for managing the sleep-inducing after-effects that follow. Effective allergy management depends on both the chemical intervention and the user's strict discipline to follow these essential